Hi YouTube. So today is my 4 weeks. I've had a few hiccups this week. As you can see, I'm still swollen here. Just like, see there, just a bit. Basically I had a check up with my surgeon, and I stopped wearing my bands last week, like I said. And apparently my dentist still wants me to wear them, but it turns out that these two bottom tabs are infected. So that's awesome. So my surgeon sent me to my dentist to talk to them about it before doing anything about it himself, just to see if they wanted to put some more in there so that they can use the rubber bands. So I went there basically so I wouldn't have to get them taken out and get them put back in 2 different procedures. I'd rather just get it done all at once. So went to the dentist, and the dentist ones are these ones. You can't really see it, but they're small and they're triangular. There's one that, these are the two that the surgeon put in after the 2 triangle ones were too loose during my surgery. And they're a lot bigger and they're round. So the dentists were going to take them out and then put these button things on my teeth that they just glue onto your teeth. It's just metal and they can hook it around it. So went there and they didn't have the tools to take these 2 out, which I'm kind of thankful for, because they went to go ahead and take them out without giving me an injection or anything. So now it turns out that the surgeon needs to take it out, and not only does the surgeon need to take it out, but he says he's not going to do it unless I go under anesthesia because they're infected, so it's going to hurt. So I'm really glad that they didn't just pull them out. So yeah, so I have 2 infections in my jaw at the moment. Neither of them gave me antibiotics or anything, so it's really tender, and it's like the gum. It's hard while I'm touching it, but it's actually swelling from the gum inside. You can see that's where my face, that's where my jawline is, and this is where the infection is. So that sucks, and I've got to get that done this week sometime, which is really annoying, and I'm meant to go back to work on Friday. Apparently Friday is the only day that they can get me in, so I'm going to try and make it earlier, hopefully, if I can. But also, so they put the buttons on and just worked around it. It was horrible. They had to make a mould of my teeth and stuff, because they've told me with the buttons that they put in your teeth, if you don't have your bottom retainer on, as I told you in a couple of videos ago, I'm only wearing my top retainer. If you don't wear your bottom retainer, you can start to pull your teeth out. So they had to make me a new retainer for the shape of it now and take the mould. It was horrible. I can barely open my mouth, and they expect me to get this big metal thing in with plaster in it. It was ridiculous. Anyway, got it done. So I've got 2 retainers in at the moment. I've got my top and my bottom. I've got elastics and infections, and show you the buttons. It's here, and that's the tad. And it sucked also because here it's still numb, but it's really sensitive to pain in a weird way. Like, I get pins and needles, and she kept pulling my lip, and oh, it was so painful. I'm really annoyed because now that I've got my retainer in, when I take them out to eat, I only take off this band and my 2 retainers and leave this band in because it's too hard to get back in. It's fine, that my teeth will go together fine, but for now my bite doesn't go together. That's it closed. still open there and stuff, and that's to close the gap, but it's so annoying because only this side bites and it's making my lips horrible. It's just such a long process and it hasn't gone smoothly, and I'm pretty much over it. I'm still on soft foods and for at least 2 more weeks, and by the look of the infection and stuff, it's going to be a lot longer recovery and the swelling and everything. Still got a bit on this side just here, but it looks like I'm going to have dimples. You can see it a little bit, you can't really see it that much, but in the, like, if I was to go look in the mirror you can. But yeah, that's all I can really think of. I've been getting really bad headaches because of the tooth pain, because of the new stuff that's in there. Yeah. Can't really think of anything else. But yeah, it's not going smoothly. I'm annoyed, I'm over it. And I'm still not happy with the result. But hopefully we'll get there. Alright guys, I'll speak to you next week. Bye.